Hello everyone, this is Miss J. Cañete again, your Tamaraw sister, now your Tamaraw mentor. And I will walk you through the part 2 of the models of health and illness. But before that, let me congratulate everyone for finishing the concepts of nursing as an art, nursing as a profession, and nursing as a science the past few days. That now you are here with us with the concept of health and illness. I can only imagine how you struggled with making it so far to be with me in this module. I suppose you have been successful in unlocking the previous learning sessions and came out in one piece, no? And I suppose a success, definitely. Anyway, a nurse taking care of the patient has to know and understand the client very well. I also, a nurse must understand her roles as a nurse, study the concepts of health and disease, and consider the different variables in the environment. All of these knowledge will help the nurse analyze very well the health situation of the patient so that she will be able to accurately identify the problems faced by the client. So she will be able to plan effectively with the client for the care outcomes through the appropriate nursing interventions that should be achieved. As we analyze scientifically the data that we gathered about the patient, no, particularly or paying attention to the cues, subjective and the objective cues. Now, we hypothesize or we infer, no, or come up with an educated guess about the nursing problems and possible etiological relationships. Then compare it with the standards of health, disease, and other scientific literatures, standards of practice, and then come up with a sound conclusion regarding that nursing problem. To choose also the best possible interventions for the best possible health outcomes to be achieved. Um, okay. Now, this module aims to further assist you in that endeavor. To understand the disease as a phenomenon, one needs to understand the concept of health. And you have recently discussed that in the introduction of this module on health and illness. You have also encountered descriptions of health, wellness, and illness in the various models previously discussed by Ma'am Joyce Asena, where she asked you to decide which model is applicable and appropriate for a particular client's health situation or scenario. Now, this module will further touch on a few models to better understand the concept of health as a guide in understanding our clients and eventually plan for their care. Also, this model will attempt to help you understand etiological relationships to further understand disease as a phenomenon by discussing the multiple causation of disease or the ecologic model. Although there are other theories in disease causation, which I will mention in passing later on, but discussion will focus mainly on the ecologic model as a framework for understanding the disease causation. Understanding the disease causation is needed to be able to address the problems of our patients, who are, because rooting out the causes of suffering is hitting the nail on its head. We cannot resolve the problems if we don't address the factors or the reason causing that disease, that illness, or that suffering. So this module is the continuation of of the models of health and illness. You have learned already 8 models, and I will be adding through the discussion of the holistic model and the iceberg model. Also, this module, again, as I said, will cover the ecologic model and how to write an ecologic model report. But for this learning session, I will just be covering these two. The number 3 and number 4 will be covered in a separate learning session because I decided to divide this into two short learning sessions for the students, also for you to be so it will be easier for you to assimilate this information. All right. Now, after the learning session, of the 2 short learning sessions, you're expected to use the models of health as a guide to relate concepts or their knowledge on health or wellness and disease or illness. Describe, analyze, and explain clients' health status and predict patient care outcomes after carefully planning for appropriate interventions. Specifically, for holistic model, you are to identify the various concepts to understand the model. Also analyze the model as to how it can help the nurse understand the condition of the client. For ecologic model, you are expected to formulate, number one, formulate an educated guess about what caused the disease or situation given a sample case scenario later on. And then you are to identify related factors playing a role in disease causation, whether it is host, agent, and environmental factors, or all of these three. And then next, you choose an appropriate model of disease causation for a given case scenario, whether it is lever, wheel, or web. And then next would be to explain the model and the relationships of the concepts presented in the model. And then next, write your conclusion in relation to the hypothesis, not the hypothesis, your educated guess about the cause of disease. And then lastly, you are to determine recommendations based on the chosen model for the case, anchored also on scientific literatures. All right? So those are the expected outcomes from this learning session. Now let's talk about the holistic model or the wellness model. The holistic model explains the concepts of the physiological, mental, emotional, social, spiritual, and environmental aspects of the individuals and communities. Now, putting emphasis that each person has the capability and responsibility for optimizing the sense of well-being by addressing these different aspects now of his personhood at the core or at the center of the model, where all the aspects intersect, no, is the point at which there is optimum health. Okay. Later on, the aspects covered all these 7 wellness aspects, no, of the holistic model, uh, namely physical wellness. No, physical wellness refers to the ability to carry out daily tasks, achieve fitness, maintain adequate nutrition and proper body fat, avoid abusing drugs and alcohol or using tobacco products, and generally practice positive lifestyle habits, because this has an impact on they have an impact on the physical wellness of the patient. The next is the social wellness, which is the ability to interact successfully, no, with people and within the environment of which each person is a part, to develop and maintain intimacy with significant others, and to develop respect and tolerance for those with different opinions and beliefs, right? So that is the social wellness. Next is the emotional wellness, which is the ability to manage stress and express emotions appropriately, also with an appropriate facial expression. Okay, so an emotional well person has an appropriate facial expression for her emotions. Okay. Also, it involves the ability to recognize, accept, and express feelings, and to accept one's limitations. All right, so that is emotional wellness. Next is the intellectual wellness, which is the ability to learn and use information effectively for personal, family, and career development. It also involves striving for continued growth and learning to deal with new challenges effectively. Spiritual wellness, on the other hand, is refers to the belief in some force, either nature, religion, or higher power that serves to unite human beings and provide meaning and purposes to life. Occupational wellness naman is the ability to achieve a balance between work and leisure time. It includes a person's beliefs about education, employment, and home, which also influence personal satisfaction and relationship with others. And then last but not the least is the environmental wellness, which is the ability to promote health measures that improve the standard uh, of living and quality of life in the community. It also includes influences such as food, water, and air. All right? So a nurse utilizing this model, no, this holistic model, uh, will consider no, the 7 aspects of wellness in gathering and collecting data from her patient. Also, the 7 wellness aspects will guide the nurse to organize her data and to analyze later on. Also, when she starts planning for care, she will consider all these aspects as well. Um, the outcomes will be measured, the care outcomes will be measured also as to what extent these aspects were achieved. No? These aspects of wellness were achieved. All right? So is that clear about the holistic model and its aspects of wellness? Next is the iceberg model. The iceberg model asserts that your current state of health, no, be it one of disease or vitality, is just the tip of the iceberg, which is seen, shown, or revealed. No? Apparently, the tip is what is only shown or revealed readily. So a nurse caring for a patient utilizing the iceberg model will recognize that there are other aspects of that client that needs to be uncovered, no, or discovered. So she will exert an effort to understand, no, the other aspects of the iceberg submerged in water by throwing more questions, asking follow-up questions to understand better the client. And these other aspects would include lifestyle, behavioral level, that would include what you eat, how you exercise, relax, manage stress, and how you safeguard yourself from hazards around you. The psychological level or the motivational level are those motivations and inclinations that moves a person to do something. Also, the level, the about spiritual beliefs, the person's beliefs about his being, the meaning, are also at the base of the iceberg, which the nurse must also consider, in planning the care for her patient. Okay, so that is the iceberg model. Um, I will have to cut short the learning session at this point, and I hope that you have understood how to use the holistic model and the iceberg model in caring for a patient as well as for planning your interventions for them. Okay, so thank you for joining me in this short session, and I will see you in the second part of this learning session on the part 2 of the models of health and illness. All right.